Hello, welcome back to Happy Mum, Happy Baby. This week we have another bonus episode brought to you from Bupa. A few weeks ago, Bupa set us up with the outstanding Sam Was, an amazing professor of child psychology at the University of East London, where he leads the Baby Dev Lab research unit. You might recognise him from Channel 4's programme The Secret Life of 4 and 5-year-olds, where he served as an expert commentator on child development issues. Sam is working with Bupa to help parents spot the signs of mental health conditions, helping parents and carers to open up conversations about mental health with their children or other young people in their lives. It's such an important topic. It's been reported that in the last 3 years, the likelihood of young people having a mental health problem has increased by 50%. And 50% of all mental health problems start by the age of 14. Honestly, my mind when I read that, I just can't believe it. And the following from a survey run by Bupa: 80% of parents say their child does not open up to them about mental health, and 76% of parents say they would not feel confident they'd be able to spot the signs of a mental health condition. So a little while ago, me and Sam, we got together and we talked about really important topics. We covered how the distance that grows between parents and teens can make it feel hard to spot the signs of potential mental health issues. We spoke about the ways we can spot anxiety in our children and how we can respond if these signs do begin to crop up. And lastly, what parents can do to start a conversation with their children about mental health. If you didn't get a chance to listen to that episode, I know I'm biased, but I think it was brilliant. So please do go back. It'll be on the feed that you're currently on. Just go back and listen. But for now, here we have Sam. You've returned. We didn't put you off. You're back.
No, it was lovely last time. Looking forward to this.
Thank you very much. Well, get comfortable. So today, Sam, we're doing things a little bit differently. We're working with Bupa, and they've compiled a whole heap of questions on the subject of mental health. So we're going to explore those. We're going to work our way through it, and we're going to unpack some of the most urgent issues we've identified. Are you ready?
Mm-hmm.
Okay. So the first question, if I try to speak to my child about how they're feeling, they often shut down the conversation and this isn't spoken about again. Any other advice on how I could communicate with my child in a different way?
I think the fact that kind of conversations between parents and teenagers about mental health often, take place in kind of a setting that kind of teenagers feel can be quite intimidating is something that is very common.
Yeah.
Teenagers kind of often have a very kind of hyper-reactive style, is what we call it. So, if something occurs that's kind of mildly stressful, then kind of they have a big reaction to it. And direct eye contact is something that a lot of kids find kind of overstimulating. And that's the reason why a lot of people find kind of text messaging quite relaxing. A lot of mental health support happens now through text messaging. So Samaritans, for example, has got a very busy kind of text messaging line. So, and I guess the really important thing about that is just, thinking like technically about how you listen. But when we're having a conversation about this sort of thing, there really are some, I certainly use them, like some concrete practical tips.
Yeah.
Of things like, direct eye contact, we were saying earlier, can be kind of challenging. Often it's easier askance, but everybody wants to feel like they're being listened to and understood. Yeah. So exactly as you're doing non-verbal cues, kind of reacting. Oh my goodness me, I can't believe they said that. Those types of cues to signal that you're listening to what they're saying. Yeah. If they then stop. Kind of summarising, so you're telling me that this happened and then this happened and that made you feel like that. Matching the words that they're using is a great way to help them feel that they're understood. Validating their emotions, so any way of saying, I can see that must have been really scary when that happened, particularly if they've just said something that was scary. Using their words back to them and just saying, you're just reassuring them that they're entitled to feel, how they are feeling at the moment. And then kind of using open-ended questions. Wow, he said that to you. I can see that must have been really scary. So what happened next? Yeah. So those just types of open-ended questions just to keep people talking. And then when it's there, summarising. So you've been telling me this happened and you've been telling me this happened and you're a little bit concerned about that. Getting it clear in your head, but also, giving that feel that kind of you've been listened to and understood. I guess the other thing that's really important is just be patient with it. So, there'll be a time when they might be ready to open up and there might be a time when they're not. Often it's really hard. You often, a lot of the times with kind of crisis moments, it's harder to talk about it in a moment. You might end up talking about it in a moment because you can't hide from it. Someone's having a meltdown or something like that. But those aren't often the most productive kind of conversations. The best conversations are the most productive ones, are the ones that happen afterwards. But the ones that happen afterwards, everyone's very up and down in their mood, and definitely it's not a question of just picking a time and saying I'm going to talk about it tonight, writing the date in the diary. It's a question of just you always have your your feelers out, are they open to talking about it, and if ever there is a time, then you just make sure you're there and react to it. So you just got to be there and ready and open, and it's always a better conversation if they feel in control. So the more you can leave up to them, the better, really.
Almost it's got to come from them rather than you forcing it.
Yeah, definitely. And, obviously this goes to one of the major things that these types of conversations are so hard to have often because, we're used to controlling our children's lives to a great or lesser degree. Getting these habits when they're young, you get to the point where, you're brushing your teeth for them, you're wiping their bum for them, that type of stuff, and you're getting these habits as a parent. And it's very hard to get out of that. And, it's the reason that parents find adolescence so hard is very often the fact that they just lose control completely. And it's really hard to reset and say, no, my child needs to feel in control of this. My child needs to feel in control of the conversation. And I just have to be there as a receptacle. If they want to talk to me, then I'm ready for it. But it's a really, really hard transition for reasons I completely understand.
Yeah, and for some children, as with adults, talking about emotions is such a difficult thing. If I think about my 3 kids, I have one that will, 2 really, that will talk really openly about how they're feeling. The other one will totally shut down and has done from day dot. And for a long time I just get a grunt actually. Whereas now it might be a little bit more open, but you can literally feel that sort of shoulder nudge whenever you kind of even broach the subject. And I know I've already got a terrible habit of going to people, you okay? You okay? I've had it all. I've always had it. And I know I'm going to be a really annoying mum when it comes to teenage life because I know I'll be tempted to just constantly go, you okay? You okay? Yes, Mum, get out, go away, And then I've got to get ready for that.
Out of interest, do you then change your tactics? Because mine are very similar. Mine are just, we're very kind of open, and both mine are very open.
Yeah, no, he's a doer. You need to be doing something with him, whether you're going out for a walk or lighting a fire or doing something. There needs to be a task at hand so that his sort of, I guess, his stress response or nervous system is kind of relaxed. It's not, he's not already fired up or feeling like you're wanting something. It's that there was almost like a demand, right? If someone's expecting of something of you in that moment, and actually you're not ready to give. Definitely had to change my tact, I would say. Another question: is there any evidence that social media negatively impacts young people's mental health?
Really tricky question. So we know that social media use obviously is going up very rapidly over time. It's gone up very rapidly over the past 20 years. We know that the diagnosis rates of mental health problems have gone up very rapidly over time. One very tricky question is it because we're diagnosing things more readily, because we find it easier to talk about problems when we have them? We're less likely to have a problem and pretend we don't now. It's definitely partly true. There's also really good evidence that actual symptoms of mental health problems are going up over time. There's various things, we've been giving the same questionnaire, things like how often do you lie in bed at night unable to sleep because you've got worries going through your head. We've been giving exactly the same questionnaire for about 50 years, and kind of answers to that question have more likely have gone up over time. So we think that they're both going up over time, but does one cause the other is very, very hard to be sure about, because to do it you need to do something like a drug trial where you give half of them social media and half of them not, and then you look at how it affects them, and you just can't do those types of studies. But as far as we can tell from studies looking at things like where they've introduced social media or they banned social media in a country, how it then affected teenagers' health afterwards, it's actually surprisingly hard to prove that one thing causes the other. There's a lot of evidence that people with mental health problems tend to use social media differently, and that in some cases their social media use can exacerbate a kind of a pre-existing mental health problem. But at the end of the day, the practical answer for parents is, if you think, and I think this myself, I'm aware that social media makes me feel anxious. I feel rubbish often after I've been on it, and I try and get off it, and a lot of young people think like that too. So, but if it makes you feel fine, if it makes you feel good, then fine. So I guess it's much more of a common sense thing than you'd say. If you're concerned, if you notice that your child tends to feel worse after they've been on social media, then, yes, it's something that might be worth talking to them about. But if they're fine, then don't worry.
If someone struggles with their mental health as a child, will this follow them into adulthood?
One of the things that we've been aware of is, and this is our attitude to mental health has changed a lot over recent years, is that we used to think of kind of mental ill health as very neat and tidy boxes. Yeah. So autism is caused by X. Yeah. ADHD is caused by X. By Y, depression is caused by this. But in fact, we're much more aware that people move kind of fluidly between different categories of mental health problem over life. On average, if you have a kind of what we call an early onset problem, that onset's relatively early, you are at elevated risk of going on to develop, other different types of mental health problem. It is often the case that it doesn't stay the problem that you're initially diagnosed with. It will switch to something else during later life. But it's certainly not the case for everybody. There are so many different trajectories of kind of problems that can be really severe for a short period of time and then can just go every different possible trajectory. And there are kind of patterns that we can pick out and study across a population as a whole. But it's very hard to apply those to thinking, understanding about your own child.
Yeah, and obviously everyone will go down a different path, and it depends how it's what the response is to it when it happens when a child is younger, surely. So if there is some sort of input, if people are helping, if a child is given tools, then surely that would have a massive input as to later on in life as well.
Yeah, definitely. That's a really nice way of thinking about it. So I mean, realizing that you have the tools to get help, and that once you've reached a certain level of kind of acuity and you have to be talking about it amongst the family, then you gain the vocabulary to talk about it. Yeah, I think that's a really, really nice positive way to think.
And I wonder if, because we are talking about mental health so much now, later on in life, how many people are able to reflect on when I was a teenager or when I was 10 or whatever. Whereas now, maybe this is the generation or the generation below us where actually they're able to talk about it from a much younger age and be taken seriously.
Yeah, and the other reason that I think that's really important is, you talk to anyone who's in an acute phase of a mental health problem, and memory is associative. So when you're feeling low, you can only remember the other times that you've been feeling low. And one of the reasons that what you say is really good is that it's just that idea that these emotions can be so acute. I've felt them. Everyone's felt them. They can be so acute, and it can feel like it's going on forever, and you have no recall for times when you haven't felt like this. And just that conversation with someone else who says, you had this, and last time you had this, it lasted, a few weeks, and then you came out of it. And don't you remember on that day you were feeling like that? And then, oh yeah, I was. I can't. It's really hard to access those emotions. But that's really, really important, just for remembering that everybody has ups and downs, and when you're at the low point of a down, there is an upcoming, even though it doesn't feel like it.
Okay, next question. Is there a link between neurodiversity and mental health? So if you are neurodiverse, are you more likely to experience a mental health issue?
Yeah, so I think it's important to be clear about a few definitions here. So neurodiversity is the idea that everybody, to a greater or lesser degree, experiences kind of sensations, so sights and sounds and tastes and things differently to one another. And linking to that, everybody has differences in, how much they enjoy social interaction, how comfortable they feel in social interaction and that type of thing. It's very much not about kind of problems being something that kind of neurodiversity being a problem that we can fix. Yeah? And absolutely justifiably, there's a massive amount of, really important correction going on here. We're used to thinking about conditions like autism in a very deficit-focused way, but we're now increasingly recognising that, in fact, if you look at a list of inventions of the important stuff that's been invented in the, by humanity, an amazing proportion of them have been done with people with autism. So it's definitely not something we want to get rid of. It's massively, massively important to us, as a society. So that's basically the idea of neurodiversity. Mental health is very kind of different. In a lot of ways, the way it's talked about is different. So everybody has anxiety up to a point. Yeah, anxiety up to a point is a good thing. Yeah? From my point of view, when I'm analysing data, it's useful for me to worry my data up to a point because it gets rid of mistakes. But then there can be a point beyond which is too much. And we tend to think of mental health as something where it's a symptom that to us feels uncomfortable, that to us is something that we want to get rid of. So that's the difference really between neurodiversity and mental health. In terms of how they're related, it is the case that a lot of people with conditions like autism tend to experience other kind of symptoms such as kind of anxiety or low mood. Definitely not everybody, but, a proportion of people do. The good thing is, parents of any kind of neurodivergent children at home, the better you are able to know that this is something that might be happening, keep an eye out for it, and make sure you're prepared by, getting the vocabulary right and that type of thing, the more you're going to be well equipped to help your child.
Another question. If another family member struggles with a mental health condition, does it make a child more likely to develop the same issue? Or can a child pick up on this and start to copy them? So
with all categories of mental health condition, there's evidence for a genetic component. So from kind of, you might have heard the phrase twin study. So that's looking at the rate of identical and non-identical twins, and all types of twins have the same environment, the idea goes, but identical twins have the same genes and the same environment. And we call it the concordance rate. So the likelihood that if one twin's got it, the other one has it too, is much higher for identical twins than non-identical twins, which basically tells us it's kind of genetics. That's the idea, at least. So those types of studies, we definitely have a lot of evidence that things run in families. There's also lots of studies for things like families where the parents are raising children that genetically are unrelated to them. So adoption studies and various other types of study like that show us that there's also a direct environmental transmission. So children evoke a parenting style from me. So if I've got a child who's more oppositional, then that changes how I parent them. But also, if I'm, things like intergenerational transmission of anxiety, there's evidence that in some cases, kind of more anxious parents are parenting their children differently. So if you are, which a lot of parents are, I was down was quite depressed as a teenager. I have, sometimes I'm feeling anxious now. Like, it's likely that my kids will be having the same types of things. The upside is I can see it coming. Yeah. I know, the early precursors. I've got a vocabulary of things that, I know work for me, that I can help talking about with my kids. I try really hard not to be embarrassed talking about it with them. So, even from a young age, I talk about it. So there are upsides to this. But the short answer is yes. Most of these things do run in families.
How can I support my child through a period of change or stress, like change in school, bereavement, family separation, or bullying?
Often, when there's something like a bereavement in a family, it's very tempting as a parent to model the type of behaviour that you think they should be doing. So we say, Mopsy, our pet, died. But it's okay, we're going to get another one. Like, it's a really crass example, yeah. So you try and be like overly jovial, yeah. So you're taking your kids to school, and it's like, and the kid's wailing, and you're dragging them by the hand, and you're like, no, it's going to be fine. You're going to make lots of new friends. You're going to have a lovely time like this. And actually saying to your kids, I'm really upset about this too. Is something that parents often find very, very hard, just because they want to be the strong one, they want to be the authority figure, they want to be setting a model, they want to be modelling how they think their child should behave, should be feeling, which is entirely natural. It's the most natural thing. But I guess the most important distinction I would make is between, long-term modelling and short-term modelling. So, someone dies in a family, of course the parents are going to feel sad. If you walk around pretending to feel happy, then, no one, you don't believe yourself, your kids aren't going to believe you. Yeah. It's fine to be sad, and the important thing is, your long-term things. Yeah. So it's sad. We are going to be sad. But we've got each other, we're going to support, and we're going to come out of this kind of long-term. The long-term strength is what's important, not the I'm in the state that I want to be in every single moment of every single day, because everybody loses it. And the other thing, I guess, specifically with bereavement is it definitely comes in waves. So you definitely have times when you're feeling, surprisingly fine. Everybody has things, this has just happened, but actually, I'm fine about it. It doesn't mean that something's not going to hit you later on. So, just be patient, just be reactive. Don't try and push people into a particular emotional state. Just wait and understand how they are, and recognise that tomorrow they might be feeling completely differently to how they're feeling today.
We had it in our house, actually. I think for most children, their first sense of bereavement will be a pet. And my husband was away, and I'd taken the cat to the vet, and the two of them had said, we thought that she was going for a sleepover to the vets. She was poorly, so we thought, she's 17 years old, but usually she just gets a shot of something and then she comes bouncing back. But sometimes she sleeps over. So I said to the older two, I'm just going to take Leia to the vet. Max wanted to come because he'd never been to a vet. I think he thought it was like a farm. And so me and Max took Leia to the vets, and the vet took a look at her and just said, "I'm really sorry, but she's really poorly," and she wanted her to put her to sleep then. And Max wasn't in the room. They took Max out, and he was drawing pictures at reception. And I just thought, I can't do this like this because I have told them that she's going for a sleepover at the vet and that she's coming back. I can't go home and say she's not coming back. So the vet very kindly gave her some steroids to get through the night. And I took Leia back with Max. And when I got home, kind of trying to plan out in my head how I would approach this and what their reaction would be. And I just didn't know what their reaction would be. Obviously, you can't. You never know. You build things up and they'll be like, okay. Or you don't do enough and then they'll, And I sat them down and I explained to them what was happening. And it was really fascinating for me in that first night to see what their reaction, because they didn't want to be around the cat.
Oh, really?
They did not Buddy, who's really quite explosive with his emotions, did not want to, and he was the closest to her, couldn't be with her. And he had an instant wail and then was pacing, didn't quite know what to do with himself. The other two were just really sad, but it came in waves. But again, they didn't want to be with her that night. But we got into bed and we looked through photos of her as a kitten, looked through photos of them as babies with her as a cat, and she was constantly with them. And it was the next morning when they woke up, they really wanted to be with her. They wanted to watch what she was doing in the garden. They wanted to, Buddy wanted to carry her to her carrier. And I did, I just let them do what they felt. And it was really hard because almost as a parent, you want to be able to take away all that pain, but you also have to realise that grief and bereavement is a part of life, and it's so hard.
You can just fix.
Yeah, you can't. You can't. So I think for me that was a massive learning in talking about death to the kids.
Yeah, and it would have been learning for them too.
Yeah, absolutely. Okay, another question. I am concerned that my child is using drugs or alcohol. How do I approach this conversation, and where can we go for help?
Yeah, so this is a really, really tricky one because I think there's often a couple of things, or certainly at least two things mixed up here in a lot of families when these types of issues come up. One is the genuine parent's concern for the child's safety and well-being, which is, of course, absolutely justified, absolutely natural. But then there's a lot of other stuff mixed up there as well. So the other stuff that's mixed up is often, you're used to making safety decisions, like all types of decisions for your kids. You get into that habit as a parent, from the time that they're young. And suddenly they start doing this thing where you tell them to do something and they do exactly the opposite. And that is a very, very complex and very, very difficult feeling to cope with for a lot of parents, that, they're doing stuff when I'm not there. I don't have any control. If I tell them to do something, they do exactly the opposite of what I tell them. And that is a very, very emotionally complex thing for a lot of parents to deal with. And those two things, I think, are very often intertwined, the concern for the child's safety and these much more complex feelings about you as a parent, your relationship with your child and that type of thing. So the only thing you can do is treat them like you trust them as an adult, even if they don't, but treat them in the way that they are insisting on being treated. You just don't have another option, But the thing that you can trust, which is really true, is to trust their own self-preservation instinct. So almost all kids, want to be safe and to survive themselves, So what you can be doing is providing them with practical information, So there are certain aspects that they might not have thought of. They will have learned about some of this at school, but there's a lot more that they won't have learned. So just providing the practical information, have you thought about this? Have you thought about this? And communicating to them that you trust them to make their own decisions in a way to keep themselves safe, At the same time, do what you can, because you don't quite trust them yet, because they've only just made this decision that I'm the one who's making the big decisions. At the same time, you don't completely trust them, because they're only just at an age when they've decided that they should be making the decisions for themselves. So do what you can to keep a close eye on them, without them, feeling like they're being observed. So fake the trust. And then, really, really watch them kind of closely as you'd want to do, kind of entirely naturally.
Yeah. It's such a big topic, isn't it? And I feel like I know that when my kids are teenagers and if they go down that path or try things, which they're teenagers, there will be a point, right? And I know that my reaction will probably be quite large and quite explosive. However, younger me, it's a very difficult thing to kind of go, I've lived there, I've been there, I tried things, but you can't, so it becomes this jarring thing. And actually, I also think that as parents, if we were to become quite explosive in our reaction to stuff, then that's going to just push your child into still doing it, but now they're doing it in an unsafe place, or they're doing it in an unsafe way because they're becoming more secretive because mum's going to fly off the handle. And that's a really difficult thing to balance.
But it's really, really natural, why parents do that. And it's about this other stuff I was talking about, this idea that, your child doesn't want, this feeling that, you used to love me and you used to rely on me and you used to, respect me, and then where's all this gone? Yeah. And it's, it's a swing and pendulum, and, it goes, and then, by the time they're adulthood, they will be back to the point where they do that. But it's just reacting to these changes. And it's really, really hard to not, it's really tempting to overreact, really, really hard not to overreact. But it's definitely, long term, you've got to play the long game.
How can I explain mental health to a child in a way they will understand?
Yeah, I guess personally, like my feelings of how good I feel about myself, how good I feel about my work, I publish lots of papers, and I have days when I'm like, they're all rubbish, I've just wasted my whole life, and then and the days when I'm feeling really good. But my feelings of that are just so not related at all to whether I'm actually doing good quality work at that time. They just go, they've got no association at all. And like those days when you just wake up feeling rubbish and you're wasting your whole life and that type of stuff. So I just say that to my kids, like we don't, we understand some of it, but there's a huge amount we don't understand still about like why it is that you just wake up feeling rubbish, and how your mood changes during the course of the day, hangry, we get that. So when everyone's hungry. And we still don't understand very well why that is in the brain. We know roughly the part of the brain where something's going on is part of the brain called the hypothalamus, but still we don't understand. So I talk about it with my kids as you just have ups and downs, and you just got to bob up and down on the wave, and we're just waves in an ocean. So I don't know, that's what I find useful.
I love that. I also very much love the fact that hangry is an actual thing.
It definitely is.
I love this. I just thought it was an Italian thing.
No.
Me and my sister can't go anywhere.
Oh, really?
We cannot. When we go out for dinner, we cannot talk until we've eaten. Don't talk to me before the starters arrive.
And the poor waiter, if the food's slow arriving, poor waiter. That's crazy.
Yeah, the Italian Essex mix. You don't want to, don't want to get that wrong. What things can I do at home to support my child's mental health and well-being?
It's that combination of trying to model the environment that you want your kids to have, which is, there's lots of evidence, stable, supportive, that type of thing. And recognizing that nobody's going to get that all the time. It's not about being perfect all the time, because that can be a massive source of added stress. I do lots of research into like parent-child interaction and like the optimal way to do it. And often when you're, trying to teach parents the optimal way to do it, then it is something that, ends up adding to the stress and, in the long term it helps. So it's the balance between the two, knowing what you should be doing and knowing what you want to be doing, but not beating yourself too much if you don't manage to do it, but just making sure that if that's the case, you can have that full, frank conversation with them.
Sam, before I say goodbye to you, I would like you to complete 3 sentences, please. I know. I'm doing this to you, okay? The first one is, if I could tell you one thing, it would be...
Don't be afraid to look stupid, because that's something I positively enjoy, but I know a lot of parents hate.
Being a dad means?
At the moment, being a dad means being a human climbing frame.
And I'm
still,
happy.
even though they're much too heavy for now, they're still climbing all over my head, or pulling themselves up on my ears and stuff.
I love that. And I'm happy when?
I'm with my family. Sorry. No, I won't answer that one.
That's all right. That's allowed. Sam, thank you so much. And for more advice and information, you can seek out some brilliant resources that can be found online by searching Bupa's Young People's Mental Health, including the latest in Bupa's Inside Health event series, Let's Talk Young People's Mental Health. This is a free event featuring Professor Sam Wass and Mining Class discussing all things young people's mental health. There are also 4 interactive Jack conversations where parents can ask their questions about anxiety, eating disorders and depression to a qualified expert and get a real-time answer. Jack stands for Just Ask a Question, by the way. Bupa has also teamed up with mum of 3 and young person mentor Mining Class, who shares her personal experience in her Jack conversation. And lastly, parents can find a downloadable guide and conversation starter toolkit for parents. And guys, just a reminder that Bupa provides health insurance for the whole family, including mental health support. Bupa have an ambition to provide young people with access to mental health treatment within 10 days, not months, not years, so young people can get back to feeling like themselves sooner. With Bupa's Family Mental Health Line, parents can speak to a trained advisor and mental health nurse about anything to do with their child's mental health. And also, it's worth mentioning that when it comes to Bupa Family Health Insurance, when you pay for your eldest child on your policy under 20 years old, Bupa will cover all other younger children on the policy for free. Pre-existing conditions are not covered and terms and conditions apply. Thank you for listening.